Welcome to WOW, the Woman of the Week podcast from Pharma Voice. This episode was made possible by a generous sponsorship from Next Level. For more information, visit nxlevelsolutions.com. In this episode, Taryn Grome, Editor-in-Chief of Pharma Voice magazine, meets with Laura Randa, Chief Commercial Officer, Curio Digital Therapeutics.
Laura, welcome to our WOW podcast program.
Taryn, thank you so much for having me. I'm delighted to be part of your WOW podcast.
I'm so excited to speak to you again. It's been a little bit since you were recognized as Pharma Voice 100. And since that time, I know that your journey has taken a few twists and turns over the last 18 months. Talk to me about this journey that you are on of reimagining and reinvention.
Yeah, it's a great question. I've been very unique and blessed in my career that I've had these three different unique phases of my career that's really brought me to today. My first 10 years, I had the great opportunity to serve under a Republican governor in the state of Delaware, and President Biden was the chairman of my board. But as you remember, President Bush actually had the points of life. And one of the initiatives is to bring community service into K through 12 education. There were amazing mentors and sponsors that helped me from early days in my career. And it was an amazing ecosystem of 49 other state leaders trailblazing this new area, really bringing how do kids learn about wetlands, but then go out and do a service project. It was phenomenal experience early days. And I was able to get involved in federal and state legislation, building public-private partnerships, making an impact in healthcare, and really, again, very, very thankful for early stage mentors and sponsors. I then had an opportunity to pivot, and I pivoted into healthcare. And I've had the opportunity of working at companies like Abbott, GSK, and Novartis. But I've also had the opportunity of working with small companies like Avenir, a small private equity firm building their first fully integrated pharmaceutical company, and a little New York eye company when I started as the 100th commercial person, and when I left, 7,000 people, and that certainly is Regeneron. I was very fortunate throughout the whole career to have an opportunity to build really unique opportunities. I was able to launch Dupixent and a very, very different model. And I'm just so excited after yesterday and looking at the Regeneron earnings. The first quarter Dupixent actual sales actually exceeded Eylea, one of their blockbuster drugs. So I have just had the great opportunity to be part of early days shaping new markets, bringing innovation to a very unmet need market. And that was atopic dermatitis for Dupixent. So during COVID, as I mentioned previously, I was at a company that actually was going to be a fully integrated pharmaceutical. So I actually, in October, during COVID, I actually took a pause and decided to take and move myself into phase 3 of my career. And one of the things that I really did was stop, pause, and said to myself, what do I like? Who do I like to be working with? What kind of technology do I like to be working with? And I hired an executive coach to work with me. And it's so interesting now that we're watching the Olympics. You know, the Olympics have coaches, every single one of them, and they work with them every day. It's so important that we, as we're, working in a workplace every single day, to also have coaches and support and sponsorship. So I hired this coach who basically said to me, let's figure out what is, what kind of company, what kind of size, what do you want to be working on? And it was interesting because a mentor of mine said, okay, you're going to leave a company on Friday. You don't have to have a job on Monday. Take the time and really think about what is it that you want to be able to do? What is it that you want to contribute in? What kind of team do you want to be part of? So I embarked in a journey that was very interesting to me. And I was so fortunate because it was COVID and everybody wasn't on planes and everybody wasn't in a car for 2 hours. And I was able to tap into people, and every single day I was so fortunate that I spoke to 6 to 8 new people and built my network to actually focus on the goal that I had set out for. And those people were board members and investors and CEOs. And I was so ecstatic that they spent some time, with me, learning about their journeys and really saying, wow, here are the pieces that I'd like to bring in for my next journey. Along the way, I helped a lot of people, but a lot of people helped me. And so today, I'm in week 3 of my new role as Chief Commercial Officer at Curio Digital Therapeutics. And it's a company focused on women's mental health. And I'm just so thrilled to be part of this new trailblazing, area, really focused on, I believe, especially coming out of COVID, fingers crossed, is going to be one of the next real struggles that we face around mental health. And I'm just so excited to be part of it.
That is awesome. I can't believe the amount of time, effort, and careful effort that you put into this next phase. And I think that as women, we don't usually do that. We don't take the time to pause and try to figure out what that next piece is. So kudos to you, and kudos to your industry recognition and record, because people picked up the phone for you, and that's also tremendously impressive. Curious, what were some of the questions you asked these folks? And I'll call them your informal advisors, if you will. Yeah. What kind of things did you ask that helped you frame out that next piece for yourself?
When we were growing up, one of the shows that I always watched was Columbo. One more question. And I think that was always that curiosity. It was really around, tell me about your journey. This is where I'm thinking I want to go. These are the things that I like to do. Tell me about, jobs and opportunities and workplaces that you actually did that. And if I'm here and I'm going to there, what advice would you give me? And who else should I talk to? And it was amazing, just those insights, really listening to people about what's really critically important. I very clearly said I wanted to be in the C-suite. I think one of the things somebody said to me, which is absolutely true, is you need to manage P&L. And, everything that, as you're talking about P&Ls, you need to highlight all those work. So really, whether it's, recently I had an opportunity to join American Association of People with Disabilities board. Work on the finance committees to really get yourself involved with, senior leaders, get them engaged, be very, very focal about your finance. So I think what I learned was really the pause of people's journeys, how they networked all the time, successful people. They were always bulletproofing, what I'm going to call bulletproofing their career. Sometimes I think we're always just too insular. We just, we work on, who are the people in our companies, who are the people in our professions, like for me, market access. But you didn't go broader. You didn't go into the commercial organization or people maybe that were doing business development. I think, as you want to round out as a leader, I think it's really critical to really ask those questions about, what experience is it important for me to have? How did you get it? What was important? How was it important to communicate that? Was it important to do it internal? Where should I show up externally? And it was just amazing how many ideas and that led to things, of everything, helping me with the companies, doing more presentations, having more social media impact, influence and acknowledgement. It was just an interesting insight. But I couldn't be more grateful because of the time that people gave me. It was probably one of those periods in my life, the 9 months, of where and how I grew the most.
That's awesome. Thank you for sharing that, because I think that's so important, especially as we see how many women are transitioning in and out of jobs due to COVID, and that there is really, that's a great roadmap to perhaps take for somebody's next step, right? Take the time to pause, ask the right questions, tap into your network, build your network even further than it is, and imagine what's possible. So congratulations. And I want to dig into the work you're doing at Curio Digital. You talked about it being a women's mental health company, and I understand you're working on an app. Is that correct?
Yeah. So what we know today is that this is just an amazing statistic. There's 200 million work days. 200 million work days per year are lost because of behavioral health conditions.
Wow.
And it costs employers up to $44 billion annually. We also know that a Kaiser Family Foundation report came out that post-COVID, we're even seeing numbers of plus 10%. So I am thrilled that we are actually going to be launching a platform to address women's mental health issues through their cycle of life. We will launch in the fourth quarter with postpartum depression. We will also follow on with contraception, infertility, and menopause. What we know is that postpartum depression is one of the most debilitating behavioral conditions of any kind. Think about if mom goes down, everyone goes down in that house. I'm so thrilled to take on this newly created chief commercial role at this new emerging company so that we're going to link not only our ability to have predictive analytics so we can actually go into databases and predict which women will have postpartum depression by risk factors, coupled with AI. We'll be able to link to workplace integrations, and then we'll have cognitive behavioral models to treat PPD. It's going to be so critical because we know that there's a behavioral health therapist shortage. We might be okay in metro areas, but in the rural areas or suburban areas, we're going to have tough shortages. And then moms, we all know that there's well visits for babies, but there's not the mom well visit. How do we deliver these important things so that moms, their spouses, their partners, and the families enjoy that new baby, and if they have any struggles that they actually are dealing with it? I had no idea before I was involved in this that there's 6 million pregnancies, 4 million births in the United States. 13% before COVID had postpartum depression, and now we're creeping into 25%.
Wow.
And then partners 10%. So we definitely have something that is a high unmet need, and I'm so excited to be part of bringing a solution, to this really important need for families.
That's amazing. I usually save this question for the end, but would you consider this to be one of the wow moments of your career?
There's so many wow moments in my career that I've been able to launching, quadrivalent flu back in 2010, 2011, 2012 was really an unmet need that we had to, bring to society. But I have to tell you, with women and families and the struggle that we're facing, being able to come in and one of the most important happy moments of their lives, bringing a new baby into the family, but really making sure that mom is healthy, making sure the spouse is healthy, and that the neonate or the baby and society are really happy to be functioning as a happy family unit is absolutely one of my big wows. I think it's way up there on the top of the list.
That's fantastic. And congratulations again. We're starting to hear more news come out. You talked about the partner piece of this. And yes, postpartum depression has been certainly something that has been recognized for many years for women, but now it's starting to be recognized for men as well. And I'm wondering if that won't help jumpstart this, because once you get the men involved, then all of a sudden it's a real problem, right? I don't want to be cynical, but you know what I'm saying.
Yeah. Absolutely. And it's stunning. 10%, 1 out of 10 dads are suffering from postpartum depression.
It's a big number.
It's a big, big number. And I think you're spot on, Taryn. I think this is one of those silent diseases that people didn't talk about.
Agreed.
And I think we are starting now. I think, we saw a Brooke Shields incident of, how, dealing with postpartum depression, and various other, social media folks that have really been out forwardly talking about postpartum depression and the impact to them. And Chicago just released a very, very large study for the partners and the spouses. So I think that finally, for the first time, it's coming out of the closet, right? And now we just have to find solutions. But remember, what we have currently today is we either have, we have IV, nasal, or, older SSRIs. They all are going to go into breast milk. As a woman, we're having a challenge right now with, vaccines or other things. People certainly don't want, medicine in their bodies when they're potentially going to be breastfeeding. So it's going to be really, really critical, to really come up with some alternative options to be able to really, have an effective outcome for the moms.
Absolutely. So I'm looking forward to seeing what happens throughout the rest of this year with you all, and then going into next year. It'll be interesting to reconnect and see how the needle is moving. And I look forward to that conversation. A few minutes ago, you referenced your work with the American Association of People with Disabilities. You sit on their board of directors. Tell me about this role and why it's so important to you.
I couldn't be more thrilled with this when Ted Kennedy Jr. came to me and, asked me to consider being part of AAPD board. Disability has impacted my family. And, I've always become an advocate for this because I've been very personally passionate about it. And my first engagement is something that was really near and dear to my heart is I was a founding member of the Disability Workplace Roundtable Group, which currently to date, which was launched in April at our recent gala. And it allows companies to come together to help with advocacy, with policy, both at federal and state legislation, and share best practices among companies about how do you hire, how do you train, how do you onboard, how do you make sure, that we're not just having gender inclusion, we're also looking at disability inclusion in our workplace. Because there was an Accenture report recently done a couple years ago that says, the more you can be exclusive, especially in the disability community, you're gonna have so much better outcomes. So it's really critical. So that's how I started involvement with the AAPD, and then it expanded into being on the board of directors. So community service has always been important to me and my family for so many reasons. I encourage a lot of people that I mentor, younger women, that I think, serving and cross-functionally serving in a community service function, teaches that, so much compassion and understanding. And there's so many opportunities to improve and grow as a leader in these, kind of cross-functional opportunities. And it's also a way to leave your mark on, on a global or a local community. So I'm excited about being part of this. This is, as a board member, this, definitely the disability workplace inclusion is definitely something that I'm very, very focused on, continuing to grow those 45 companies that we launched with to many more companies. And hopefully we can really, make an impact into our workplace. We've all seen signs everywhere we go that we're hiring. Here's a whole new community, whether it's people that are, in wheelchairs, whether it's autistic. President Biden just put the long haulers in executive order under the disability community. Pre-COVID, it was 60 million people, 1 out of 4 Americans in the United States have a disability. I'm just so passionate that we also need to be including them in the workplace and giving them the support that they need.
You couldn't have said it better. That's awesome. Thank you so much for all the work you're doing there on behalf of so many millions of Americans. Because you're not busy enough, you're also the co-chair of the Executive Women in Bio in the Capital Region. So tell me about what this role entails for you and what you're doing for this organization.
I am a true believer that, and I think it was relearned for many of us during COVID, of how powerful our support networks are. Don't wait until you need your networks to build and reconnect with your networks. How do we support each other all the time to be able to make a stronger ecosystem for everyone? And again, I go back to, I've had amazing mentors and support all over my life. And, one of the things that I've been really committed to doing with, Executive Women in Bio is how do we help these younger generation women to secure leadership roles and ultimately, get them to their leadership goals, whether that's the C-suite or, or whatever else they may be interested, board members or whatever. But I think we have to help the future just like so many people helped me. So that's my commitment. And I serve with a very, 2 wonderful women. We actually share co-chair, and it's been extremely fun getting this up and going in the Capital Region. And it's it's proven to be such a valuable asset for so many people. We hear that over and over again. It's so exciting now to take the time to really develop us and, not just do our work, but, give some time to us and enrich us and, build friendships and, make those connections, because I think we learn every single day from so many different people.
Awesome. And your board roles don't end there, because you also sit on the board of, am I pronouncing this correctly, Tutela Pharmaceuticals?
Yes.
And Springboard Enterprises. And I know Springboard is of particular interest because of its mission. And that's all about the women too, yes?
Yeah, absolutely. So, as you could probably hear from my earlier comments, is I've been very mission driven all throughout my career. And, I was very fortunate that Amy Millman, who, 20 years ago had, started building Springboard, had this vision of, bringing a forum together to bring women together as emerging companies and be able to support them going from, there was a big regulatory approval focus, but how do you go from a regulatory approval to planning for commercial success? So I've been real involved with emerging companies in both the women's health space as well as the digital therapeutic companies. And it's been very rewarding, to see how those companies have grown. Some have, a couple have even gone IPO, which was super exciting. But, also just seeing how they've brought the products to market or even sold their specific companies or assets. So it's been very, very rewarding. And I think that's one of the things that I would tell people that really made a difference in my career was broaden yourself from just your daily, your normal kind of payday job, and really kind of expand, because you see different viewpoints, you meet other people, and just your view, your whole world kind of grows bigger.
Absolutely. You've offered a couple of really key pieces of advice. Open up your network, build that network before you need it, step outside of your comfort zone a bit, think about P&L responsibilities if you want to get to that C-suite. What other advice that you can offer to women who aspire to the C-suite and are trying to map out that journey for themselves?
I think the probably the other last pearl that I think very much, we talked about this, was don't just talk about how great a new product is. Talk about how it's going to increase sales calls. Talk about how it's going to drive revenue growth. Talk about how it's going to improve market share, how it's going to impact the business. It's really, really important, because I think when I talk to CEOs or board members in my journey over the last 9 months, it was surprising to me how many of them said, we can't find the right leaders. We don't have the right people with XYZ experience. And so that's why I just really think that not only do you need to get the P&L management experience, but you've got to create and be able to talk about the impact of it, what I just kind of highlighted. I think the other thing that's really important as emerging executive, and especially as you're, escalating levels, in the organization, is anytime you come into a company, the first thing you're going to do is create a vision for success. What does it look like for me as my new role as CCO? But what does it also look like for the organization? How am I going to execute it? And execute it flawless, beat the goal, be successful, and continue, spend the time with your team. It's so important, because I think, I don't look at myself as a business leader. I look at myself as an overall business leader, not just as a chief commercial officer. So it's really important to be able to say, what's the best thing for the business? So I think that's really important. Like, you certainly have to own the part of the business that you also, are, certainly responsible and accountable for, but also, as you get higher up in the leadership, you also have to make sure that the overall business is running and the teams and the people are all working together.
Absolutely. And that is a great way to end our chat today. Your insights are so valuable. And I can't thank you enough for being part of our WOW podcast program. I hear the passion in your voice. I am inspired by you. I can't wait to see what happens with this new company you're with, as I said, and we'll be tracking it over the coming months and into like the coming years. I want to wish you continued success and thank you for all that you do for so many others.
Taryn, thank you so much for having me. It's always a pleasure of mine having the opportunity to sit down and talk with you. Thank you again.
Thank you for listening to this episode of WOW, the Woman of the Week podcast. And thanks to Next Level for making this episode possible. For more information, visit nxlevelsolutions.com. And don't forget to check out our other WOW episodes at pharmavoice.com/wow. This 2021 program is copyrighted by PharmaLinks LLC.